welcome to Macros with Mythili, the ET Now show that takes a hard look at all the major macroeconomic issues and developments in India and overseas. In this edition, we're extremely privileged to have with us the State Finance Minister of the state of Kerala, Dr. Thomas Isaac. Kerala has made a name for itself by the way it has handled the COVID crisis. So we're extremely privileged to have Dr. Isaac with us to tell us how exactly has Kerala gone about handling the crisis. Welcome to the show, Dr. Isaac. Well, as I said, Kerala has received a lot of praise for the way it has handled the COVID crisis. Today's Times of India Delhi edition talks about how Kerala has one of the highest recovery rates, lowest mortality rates, etc. As the first state to report the first COVID positive cases and now has the third largest number of cases after Maharashtra and Tamil Nadu, this is a very commendable achievement. For the benefit of our viewers, can you tell us what is it that Kerala did differently? How did this become possible? Is it because of better preparedness, better administration, better primary healthcare, better panchayati raj institutions? You tell us, Dr. Isaac, what are the factors that contributed to Kerala's relative success?
Is the break the chain campaign, the social distancing. And I think people have remarkably accepted it to a great extent, much more than we initially expected. That will have to continue. Many of our habits have got to change, and this is the beginning. Second, very high level of testing. Of course, nowhere near South Korea and so on, but you know, much higher than the level of testing in rest of India. So we have been very careful to identify each case, trace each of their contacts, then isolate them, then test them. Then if they are testing positive, once again quarantine, trace them, trace each of the contact, quarantine them. So this has been very systematically done. We were prepared for that because we had the experience of Nipah, which cost us 17 lives, but we contained it at that level. So therefore, our health department knew what should be done. And third was right from the start, we ensured a certain level of comfort to people who are quarantined, people who are under the lockdown, about massive payment of money into the hands of each individual, 8,000 rupees each as welfare payment to 55 lakh persons out of a population of 3 crore little plus. And then you have about a free kit, food, 15 kilos of additional rice and condiments and pulses and so on to every family. Now, if somebody is hungry, we have opened around 1,400 say, food stalls, community kitchens from where free food is distributed, and so on. This is very, very important that you take care of the people in this time. It's not enough to lock them down. So we have been at that. But most important is our health sector, public health system, which is, I think, the most widespread in India. And with the geographical evenness of the institutions. And recently, this is not something very recent, it has been there from last 1 century evolved. But now recently, in the last 4 years, we have pumped in something like, you may be surprised, 4,000 crores of rupees in the equipment and the hospital facilities, appointed another additional doctors, nurses, and paramedicals. And we have also brought in a buffer, popular civic buffer for the health system through palliative volunteers, other health volunteers, and so on. So, in fact, this is a remarkable achievement, has been contained because we have a front line of health system, which is remarkable.
Kerala, along with other southern states, Dr. Isaac, has a high migrant population. How were you able to ensure that the lockdown did not lead to the kind of mass migration with all its attendant problems that we've seen in some of the other states?
Okay, one, we issued a notice to all employers, they will have to provide them with food and accommodation, whatever happens. Of course, this cannot be sustained in that manner. Then, but a few days were required for government to take over. So then government has taken over. Any migrant laborer who needs food can go to our community kitchen or order it, and food will be delivered to the camp. And there was some trouble in between when the mass migration, panic migration from Delhi took place. There were the pictures, the rumors spread that trains were waiting to take them from Kerala. Then some people, restlessness came, but we pacified it in the sense senior officials went around and talked to them. This is not possible. It cannot be done. And um, we ensured minimum the food and accommodation to the persons. In case for some reason they were not accommodated, we provided public accommodation to them. And this is very important. And I think this has been successful. They have had no problem since then.
I said two things are essential for a fight against a crisis like this. One is a functioning delivery mechanism, which you've already explained, and the other is finances. Given that revenue from tourism and sale of alcohol, two big sources of revenue in the case of Kerala, are going to be badly hit, and GST revenues are also going to be hit thanks to a lower level of economic activity, how is the state going to finance this kind of expenditure?
It's true. It's true. When many people see this kind of spending, they ask, how do you do that? In fact, we are in deep trouble. Our revenue in the lockdown will be, say, 20% of the normal. Even if the lockdown is lifted, revenues for state government is going to be 50% of the normal for the next 3 months. So how do we manage this? There's only one way. We cannot. We have very serious hard budget constraints on the state government. So what we have done is we have just front loaded all our borrowing. We are going to borrow 12,000 crores this month and next month. Already 6,000 is going to auction on 7th. So by front loading our borrowing, we are spending this. Because you hesitate, you are begging trouble. Now you want to win the fight against COVID, keep people at calm in their houses, and do this extensive tracing and testing. And if you are sick, assure them a treatment with dignity. It's very important to have it. You cannot hesitate to spend the money. See, so some people say Kerala is going to be in trouble, the media, maybe, but not bothered. Now, the most important thing is not your budget, your money, but human well being. See, that's the paramount thing. And that is also key to the success of fighting COVID. So, if you ask me what I have done, two things. One, front loaded our spending. Two, see, Kerala has a number of popular parastatal arrangements at local level. For example, Kudumbasri. It's a self-help group network of women, but unlike other places, it consists of neighborhood groups, many unique features. Their repayment track record is 99%. And therefore, we have just asked them to borrow. We have leveraged something like 2,000 crores immediately for disbursement as consumption loans, whose interest will be paid by the state. Similarly, we ask Kudumbasri, they have the catering units, etc. Their catering units are handling all these kitchens that come up. Local governments are very powerful and they are very vibrant. And therefore, the food and so on, government doesn't have to provide the materials. Everything is collected from the community, vegetables and so on. They run it. See, for example, this local camps of migrant workers. Every day, the local government send in a report, what has happened, how many camps have visited, what is the situation, and so on. For example, payment of this 8,000 crores of rupees to 55 lakh people, where do I get the money? Well, the cooperatives financed it, bankrolled it. Of course, we had to pay them sometime, but immediate response came from the cooperatives who pay to these welfare pensions. And then we have welfare boards, but some of them are very powerful. So they are giving 5,000 rupees, 10,000 rupees advance to the members, every one of them. See, therefore, these are kind of popular institutions, very independent and autonomous of the state government, starting with the local government, women networks, palliative groups, and so on. Kerala's palliative network is the largest in the country. There is not a single household in Kerala which is not covered by some palliative network or other. So these have come into play. So government also gets a breathing time. Of course, they cannot take over what government should do, but for some time we can delegate the work to them. So we front load our borrowing and spend, and then we also seek the help of all these popular institutions. So this is how we have met the financial challenge.
Let me just interrupt you there for a moment, Dr. Isaac, because it's time for us to slip into a very short break. But please do stay with us. We'll be back very soon. Welcome back. You're watching Macros with Mythili, and I'm in discussion with Dr. Thomas Isaac, the finance minister from Kerala, and ask him what is it that Kerala has done differently from other states to account for its remarkable success in tackling the present ongoing COVID-19 crisis. Dr. Isaac, you spoke about front loading the government's borrowings, but the state's fiscal deficit is already at 3%. It was 3% last year, and you budgeted for this to be 3% this year itself. Given the fact that the package to date announced by you amounts to close to 72% of the fiscal deficit for the state, what are you going to do about it? Are you going to approach the center to try and amend the FRBM Act, the Fiscal Responsibility and Budget Management Act?
Yes, I'm seeking, and government of India has been just pretending not to hear the voices. I am certain government of India will have to concede to this demand here. Now look at US of America. Even Trump is supposed to have a program 10% of his GDP, 10%. And this is going to be financed by the government borrowing. And if every government in the world is going in this track, India is following the most conservative fiscal strategy. And therefore, we have been trying in our various ways. This is suicidal. If we allow this COVID situation to slip into a community spread, a pandemic, then there is no escape to be tragedy. And therefore, please don't care about this money, this number game, rule game. Spend whatever is necessary. Now, government of India is hesitating, but I am dead set. They will have to revise their position. They will have to raise the fiscal deficit ceiling of the state from the present 3% to 4%.
Entirely on this, Dr. Isaac. And as you mentioned, unfortunately, the government of India is not spending as much as it should. But states have already been given an additional 30% by way of the ways and means advances. And this is not going to be enough. So, what other kinds of support are you expecting from the central government?
Now, 30% of ways and means, do you know how much it is? Okay, our ways and means advance is 1,000, say, 1,200. That's the ways and means. Then we go into overdraft. So 30% means how much? Another 300, 400 crores. That's it. And that's nothing, peanuts here when compared to the challenge states are facing. Therefore, I ask for the following. One, give us the GST compensation. This month, for example, entire GST revenue potential has to be given as compensation. This is something legally binding. You can postpone it, but you'll have to pay it. Then why don't we be graceful enough to give in this time when it is almost urgent? And you may wonder, how do they get the money? Just borrow, yeah. Just borrow. It was discussed in the TST council when Arun Jaitley was heading it. What would happen in case the compensation was not sufficient for the payment? And Jaitley just said it's in the record. Oh, there are so many ways. We can get the government of India permission for the fund to borrow, pay you the payment, and extend the cess period from 5 years to 6 periods. That's all. Why when this results in no extra burden, I do not understand why they're hesitating. So that is number one demand. Two, provide additional grant to states because of COVID situation. Absolutely. Not a single pie has come from the central government because of COVID situation. All that has come is the last installment of the last year's NHM funds have come. That's it. And a permission that you may use the SDRF fund for COVID purposes. Now, increase your allocation for NHM, yeah, double it or three times and provide more money to the states. And three, increase the borrowing ceiling of the states from 3% to 4%.
In fact, we spoke about the union government borrowing more, but the union government actually has an advantage that state governments like you do not have. It can print money and spend, which is what I think it should do at times like this.
You don't monetize for three reasons. You are afraid inflation will come. What's the matter? Yeah, when you are sitting on a stockpile of 3 months, 4 months, food grains, what are you talking about inflation? Two, you have the option of reducing excess duty and petroleum products to keep the inflation in check. So be straightforward. Don't do this hanky-panky stuff. Just go monetize it and borrow. There is nobody to borrow from the banks also. Your provider reduce the CRR, and who is there to borrow? It's a crazy thing. CRR and monetary instruments are going to have no impact upon investment or borrowing. Monetary policy are reached the limit.
Let me now move to the Finance Commission, Dr. Isaac. In the interim Finance Commission report, Kerala's share among the states, as is the interstate share among the states, comes down from 2.5% in the 14th Finance Commission report to about 1.9% because the Commission has taken the 2011 census numbers. And of course, you have gained because you've got a revenue grant of about 15,000 crores. But the COVID-19 crisis clearly shows that all the estimates made by the Finance Commission have become now virtually meaningless. So is there a case for asking the Finance Commission to rework its estimates? Would you like to see that happen?
See, they extended the uh, final report, main report, saying unsettled times it is difficult to make calculations. But now, what kind of calculation can you make? How do you know the COVID is going to become pandemic? There is absolutely no calculation can be made with regard to the future. Therefore, I think they would have to extend the final calculation till normal times come back. Anyway, they have given a report for the 2021. Um, that's the one thing. But I'm happy they have rejected central government suggestion to do away with revenue deficit grant.
Isaac, Kerala is also the beneficiary of large number of large remittances from the Gulf. Given that post-COVID, this is definitely going to come down. This is going to have a huge adverse impact on the state, not only in terms of employment, and Kerala already has one of the highest unemployment rates in the country, but also in terms of income. How are you going to handle the post-COVID fallout of that?
Let me tell you, this is my biggest worry. Uh, Something which is going to come. One, the economies in the Gulf are in doldrums. They have already told the employers they can retrench the workers. And now, suppose in a global slum, what is going to happen is heavy retrenchment. There are about 20 lakh persons working there, Malayalis from our state. One doesn't know how many are going to come back. Now, this coming back raises two questions. One immediate. Now, this simply makes a joke, totally insufficient the arrangements that we have in Kerala for quarantining and testing them and so forth. We are already very fast requisitioning hotels, hostels, everything. Already 1 lakh additional beds have been prepared to meet any such eventuality, but we'll have to do even more. That's the immediate thing. Second one will be, well, the remittance are going to come down. Remittance contribute to about 35% of our GSDP, 35%. That is the level. Okay, the first impact doesn't come into the GSDP, but secondary impact comes in. And the remittance that comes in comes to around 35%, 30% of GSDP. It can come down. and that will have serious multiplier, reverse multiplier impact upon the Kerala domestic economy. Then there will be pressure on say employment. So we were already thinking something of this kind is going to happen because Gulf, this native labor, indigenization program, and so on. Therefore, in my budget 3 years back, we said Kerala may face a regional recession, not national. Now it has become national. That is a different scenario. But I'm just thinking at the regional recession. And therefore, we had an institution outside the budgets. The state government cannot borrow beyond the FRBM limit. Yeah, in Kerala Infrastructure Investment Fund Board, which would borrow and make investment in infrastructure so that Kerala changes its development path to attract new industrial investment in sectors which are most suitable for it, like knowledge-based industries, skill-based industries, service-based industries, and so on. And it's a very ambitious program. You may be surprised if you want to know the number. It's a 50,000 crore infrastructure investment program. And we have already 30,000 crores projects on the ground, on the track. So we are going to be in a position to have this huge anti-recession package on the roll in Kerala in the next months. And I think this is going to be an important element that is going to hold up the Kerala economy.
Dr. Isaac, one of the perennial debates in development economics is really about the merits of the Kerala model of development, with its much greater emphasis on trade-driven efforts, better human indicators, greater equity, etc., along with, perhaps middling levels of income as compared to the more market-driven levels of kind of models of development. Do you think crises like this and the success that you've had vindicates in some way the Kerala model of development, Dr. Isaac?
Yes, very much. I'm very proud of it. There are three models in India. One is Gujarat model, I would say, where you have a very industrial development but no human development. And there was this traditional Kerala model where you have human development but no industry. And of course, then there is Bimaru states where there is neither industry nor human development. So, so, so now no, no. This is like Hindu rate of growth. I'm referring to those discourse of the time when he used to say Bimaru, Heartland India, Hindu state. Now, we know this perspective, but this is the uneven development in India. Now, we want to have a new path, new model where a growth which will be high human development and high industrial growth, but industries which are more in tune with our environment and human resource endowment. Therefore, we are planning a shift in the development path. And therefore, I see it this way. I'm very proud of what Kerala has chosen, not today, historically chosen. and and very proud that I am also part of a big effort being made to make a new other model which is more in tune with the global change and realities.
My last question to you, Dr. Isaac, is really a political one. Elections are due in Kerala in 2021. Historically, power has alternated between the LDF and the UDF. Do you expect the political dividends from the way you've handled this crisis is going to break that pattern? And will it see the LDF return to power?
See, let me put it this way. What we are doing now is not done for narrow electoral victory, because this is a process in which everybody is involved. We want the opposition. Our local governments are shared by both opposition and ruling parties. So it's a fight with the Kerala subnationality, all of us together in the fight to defend our gains. But at the same time, it is for the people to judge who is doing better. I am putting my best. Are everybody putting in the best? Now, here is a crisis. Have we given good leadership in the crisis? Or have we become panicky? Now, all this is going to be judged by the people, and we want to be judged by our record. And I think uh, I get this good feel that Kerala history is going to be changed for the second time. First time in Kerala, the left will come back to power continuously. And that I feel, like my gut feeling. There is something now that you feel like this. It's coming, it's in the making. Um, I had this feeling when, say, People's Planning Campaign in 1990s, then something happened. We could do nothing about it. And we didn't know what to do about it. The entire collapse of the prices of commercial crops, everything on a collapse. And no government, whatever they do in local governments or decentralization be standard, that was flown off. And we were done away with. Like that, there were upsetting chances. So there can be always uncertainties. But today, as of look, I think the people appreciate that is being done. Not only people outside, but people in Kerala also.
Well, I'm afraid we've run out of time completely, Dr. Isaac. Thank you so much for joining us, taking time out to give us the key takeaways from the Kerala handling of the COVID crisis. On a personal note, it makes me proud to claim that I am from the state, even if I am a non-resident Keralite. Thank you so much, Dr. Isaac. Thank you also for watching. Remember, we'll be back next week with yet another edition of Macros with Mythili. Till then, it's thank you and goodbye from all of us at ET Now.